Okay,
and
thank you.
I yield the floor to Mr. Daniel Aron.
Okay, first of all, I would like to excuse myself because because some technical reasons I don't have a presentation to show you. So if you allow me, I will speak freely about my subject. Um, and after I was invited by Professor Erchin, I was thinking what would be interesting to the audience and also to be in accord with the theme of your conference here. And I was thinking to discuss about the mass casualty in the war, uh, okay, because this is my also my domain of expertise. So first of all, I will also want to let you know about my background. I'm a military doctor. I was deployed in uh, in the missions with my units 3 times in Afghanistan and once in Iraq. Then I was taking positions in decision-making levels in the medical support of a division. And after that, I worked for 4 years in MilMed COE, Military Medicine Center of Excellency of in Budapest. This is the NATO MilMed COE. And since last summer, I came back in Romania, and I am dealing now to implement in my country what I learned and what I produced in that international organization. One of the biggest projects which I was in charge with in MilMed COE was to organize the biggest multinational exercise, medical exercise ever, with 2,600 participants, all medical professionals, and 54 medical units in the field. And there, one of the biggest and most important lesson which we learned after that very demanding exercise was that we are not prepared enough uh, to face with the consequences of the the war and to deal properly with the uh, casualties which may result in a symmetrical war. So you are students. This is what I understood, that the audience are students. You have to know that the war right now in these modern times is classified in several ways, but one of the ways is the symmetrical and asymmetrical. Um, and I will explain a little bit. The symmetrical is when the forces which are fighting against one against each other, the other one is that is symmetrical, and the forces as are uh, the same, have the same power. Um, in the last decades, we faced the asymmetrical one when just one nation had the power and the other nation didn't declare themselves that they are fighting against the first nation. So like in Afghanistan, you don't know where is the enemy. Uh, there are all civilians, and you have the supremacy in the air, and then you have here and everywhere military bases, and no other uniforms are attacking you. So you sometimes and sometimes you need to think about and now I'm not speaking like a doctor, like a military, who is your enemy and to select your enemy. And that the intensity of casualties and the flow of casualty is also asymmetrical, because time to time you have uh, lot of casualties, but not every day, and in the day, not all the day long. And the medical system, the medical support is used right now, and now we are profession. We get a level of profession. Sorry, and I just want to let you know that the efficiency is so high, and we learn so well to treat and to deal with this kind of flow of casualty that we managed to save 90% of the casualties which were evacuated from the point of injury. I will not say that that is easy. That involves a lot of procedures, a lot of training, and a lot of special materials. We can say that we are great. I will say, and I would say that we are prepared for this kind of war, but not for the classical war, for that symmetrical war, which is possible to occur anytime in this global environment right now. So how we manage with that kind of war when the forces are face to face and they are shooting each other, and how we manage with the civilian casualties, which also occur in the war zones, and the medical systems are overloaded, and the medical supplies are overloaded. I would try, if you allow me, to explain you what are the level of care and how the military is organizing themselves for building up the medical support for this kind of operations. So in front, in front we have the role ones. We have some medical facilities which are assigned in each battalion. The battalion is that unit which consists with about 500 soldiers, and in each these kind of battalions we have a role one, a medical facility which can perform emergency medicine, a very low level of damage control, trauma care, and preparing patients for evacuation. The next level of care is the role 2, is called role 2, where is actually the first hospitalization footprint in the field, and that serves as a surgery capability for the 5 these kinds of battalions. So 5 these kinds of battalions, which I explained before, are incorporated in one brigade. So in each brigade we have a role 2, and we have role 2 Bravo, basic, and role 2 enhanced. And here is the first time when we perform surgery, especially damage control surgery, and also resuscitation. And here is the first point when we can give to the soldiers and treat the soldiers with blood and blood products. And the third one is the role 3, which is highest one, and about 10 role 2s are sending their casualties to get the definitive surgical care, and not just surgical, but also other specialties. I will just let you know how it is right now. Role 2 Bravo, role 2 basic is capable to deal and to treat about 12 casualties per day. But if we estimate the level, the number of casualties in one day, for a unit, for a battalion which is fighting, we shall think about at least 80, between 80 and 120 if they are fighting hard. And now I'm going to tell you what is that mass casualty by a definition. A mass casualty is the situation when the numbers of casualties is exceeding the capability of the medical treatment facility of the hospital to treat that number of casualties. So we defined it and we prepared and we made plans for mass casualty situations, putting all the resources like you see in disasters. You have a disaster with the earthquake. Of course, we have a lot of casualties which exceed the capability of the medical system to deal with in that moment. But the earthquake, it's just one time. In the wartime, this situation can persist days and days and days one after each other. And that's why I called my presentation and my team like the continuity of the mass casualty in a war. It's like a normality. The mass casualty normally is a exceptional situation, but in the wartime we have to think that we need to get used with it and to consider it like a normality. How we manage that kind of situation, this is a big challenge for all the medical system and the biggest nightmare for everybody who is trying to plan and to be prepared for these kind of situations, is that a good distribution of the assets like the roll tools. We need more roll tools in each brigade, so just one roll tool is not enough. And the decision makers have to think about this very seriously. And the other point is the level of medical care, so to decrease the level of treatment and to increase the speed of evacuation. So we will just perform not so many maneuvers to the casualties, but we will prepare them much more quickly to be evacuated and to create a much more complex and efficient medical evacuation system using medical assets like ambulances, ground and air evacuation, and also the command and control of this kind of situation. We need to make very detailed and calculated plans how to control these units, the maneuver and the positions of that units, how we can provide them enough medical supplies and also protection for the assets, for the personnel. And also another challenge is how to track the patients, because the patients have to be tracked. They are getting from one unit to the other unit, and we need to know where is everybody in every moment of these kind of situations, like mass casualties, the continuing mass casualties. Sometimes we mix the casualties, the civilians and the military, and also a big challenge is that there are no anymore just two countries fighting with each other. There are coalitions, so you have soldiers from one nation getting in the facility of the other nations. So again, the biggest challenge is how to plan that and how to increase the capability of the something's happening with the, can you hear me?
Yes, we can hear you.
Okay. And one of the most important parts of this management of the mass casualties in the war is the training. Because we can make plans, but we are not dealing with this situation during the peacetime. Sometimes we can even think about this in this in this time, in the peacetime. But if we want to deal with with this efficiently, we need to organize trainings, and that kind of training is very important to show in order to show up our weaknesses and to and challenges, and to find solutions to cope with that. And that's why this kind of multi-level with very good scenario and very good simulations, multi-level exercises, which includes also the assets, the command and control chain, the logistical chain, and a very good simulation of the casualties and the numbers of the casualties are essentials to let us to be prepared in for that kind of situation. So that was the large scale exercise about which I started to present when I presented myself, and I encourage every system to organize such kind of exercise nationally and multinationally, and also to let the students to be part of that exercises at the level of individual training and collective training, and also to be simulators and to see the route of casualties and what is happening with the casualties from the patient perspective. So sorry about my very late joining here, and sorry that I didn't have the presentation ready. I promise that I will send you my presentation properly, and I'm ready to, I will conclude here my presentation, and I'm ready to get any kind of questions, and I hope that I can answer.
Thank you very much, Mr. Aron. We up to now have received 2 questions from a person, Hanifi. Hanifi would like to ask the question himself, and I yield the floor to Hanifi.
Thank you very much. Hello, Lieutenant Colonel. I have 2 questions. I would like to ask about a military doctor profession in the NATO system. How can one be a NATO member as a doctor?
So if I get it well, what kind of training gets the doctor in the NATO? That was your questions?
For getting a job, I mean, in the NATO system as a doctor.
How is the job to be a doctor in NATO?
How to get a job?
How you get a job? You need to be part of a NATO nation, and Turkey is
a part. Yes.
A part of. And yes, your nations will send you when the NATO is requiring positions. For example, you can get a position in, you should be military, and you should be part of your military system. Are you military?
I'm just a student at the moment. I understand now.
So you have to go and to apply for a military position when you will get your graduation and you will become a doctor, a military doctor, then you are already a NATO doctor.
Thank you very much.
Okay, and the second one?
In Iraq and Afghanistan missions you partake, which occupation of yours did you see was the most important for you, the doctor or the soldier?
Which kind of patient was the most important? Doctor? Always
in your missions in Iraq and Afghanistan, which one of your occupation was the most important for you, the doctor or the soldier?
Okay, the most important part was to be a doctor and to save the casualties and to treat the patients. Of course, that in that kind of environment, you can do it if you have just if you also have a military training. So both of that was important, but of course I was focused to treat the patients.
Thank you very much.
Thank you for your questions. Very good questions.
May I ask something to Daniel?
Yes, please.
Do you want me to share the introduction video of Vigorous Warriors with the students? The video on their webpage?
Yes, of course.
Just to give a perspective to them.
Of course, you can do that, and I think it's a good idea. Yes.
Let me
do that, please.
Share them. Then you may give some more information about the exercise if you want.
Thank you very much for this presentation, Professor Elchin. Yeah, it shows how complex is that exercise. Also, the civilian involvement and also during these mass casualty situations in the war, civilian population is affected. And also, the military are not working alone; they are working side by side with the civilian. What I would like to emphasize is that the simulation, medical simulation for this kind of large-scale exercises, and I want to underline that you personally were part in our activities trying to organize this simulation, because that is very important to make the audience to feel like in the real conditions. And I understand that you have also ambitious program of in simulation in Turkey, and I'm encouraging you to do that. And if I can support your initiatives, please let me know, and I will do it with all my heart. And yes, that was about, yeah, impressive film. I just review it now, and I got some nostalgia from that time.
Yes, you are one of the creators of those activities. So I want to emphasize your contribution to those large-scale exercises. And this is just kind of a sum up for our audience, because during the sessions in these 2 days, they listened to the different speakers about how the management is important, how we can organize the systems for disaster medicine and mass casualties. And this is all shows how we can get prepared for those events from the military perspective and from the medical perspective, civilian perspective. So you are the real person who leave both sides together and creates those examples for us. Thank you.
Thank you very much. Thank you, Professor.
Thank you very much for your session. And by the way, dear participants, please don't forget to fill out the roll call form. I would like to remind that. And Mr. Daniel, if